Everybody's ready, connected? Okay. Good afternoon, everyone. I am Rachel Bunch. I'm the Executive Director of the Arkansas Healthcare Association. We represent long-term care providers in the state. And I would like to introduce Dr. Shah to you all. She is the Medical Director at Briarwood Nursing and Rehab Facility here in Little Rock. And she wanted to speak to everyone today about the situation. We want to keep this as brief as possible because she does have to go back and treat some patients.
So hi, my name is Dr. Shah. I am the Medical Director at Briarwood Nursing and Rehab Center. I've been there for about 12 years now, taking care of long-term care patients and subacute rehab patients. And as you guys are all aware that we have residents that have tested positive for the COVID-19 disease. We are providing care to these residents, and care which is consistent with the CDC and the Department of Health guidelines, and we're working diligently to prevent it from spreading, and we are following these guidelines very closely. And so far, we're currently staffed consistent with the law that in large part it's dedication to continue to provide the best care we can to the patients who have been identified as tested positive. We are maintaining strict isolation and following guidelines and making sure that we are in compliance with all the recommendations from the health department and the CDC.
And before we get into questions, I wanted to just make a couple of comments here. Dr. Shaw and I, all of our members, we would sincerely like to thank Governor Hutchinson and Dr. Smith for their comments this morning of appreciation for long-term care workers as they are really working hard trying to take care of our patients. We really appreciate their support at this time. We would also like to thank the Arkansas Department of Health for their support through this, and our partners in the medical community, other physicians, our hospital partners, all of the medical providers.
Yes.
Go ahead.
Sorry. The governor did endorse how well our staff has gone above and beyond, doing more than 12-hour shifts, at times volunteering to stay there if needed. And that endorsement from the governor means a lot to us. It helps uplift the spirits of the staff. I want to give a shout out to the administrator, Joan Robbins, the DON, Mary Lowe, and these are just two of the names, the leaders that are actually going above and beyond. Every one of these residents' life is more important, they have said time and time again, than their own life. So whatever it takes, the staff at Briarwood is doing, and I am myself proud of being part of that team because I know this team is so dedicated and efficient. And we've had members from the community, church members, other people who've had residents' families who have asked what can be done, send pizza or coffee for the staff that's just put their lives on hold to take care of the residents there that are affected. And we appreciate that, and my appeal as a doctor is that these are the people who are out there in the trenches doing due diligence to contain this for our community, really. So if all of you out there, whoever wants to support these workers, please don't hold back. This is the time for us to all come together and help get our elderly better and get these folks in the best resources to continue to care for them.
The other thing that I would add, we understand here at the association that there may be various healthcare workers who have been laid off or displaced from their work because of the COVID situation. And what I would like to say on behalf of long-term care providers across the state is that we're looking for workers. As Dr. Shaw stated, the facility at Briarwood has enough staff for today. We're going to be looking in the coming days and months as we plan ahead to get additional staff and people. So if you are in the community and you're an RN, an LPN, a CNA, and you are looking for work, I would encourage you to visit arhealthcare.com or call our office, 501-374-4422. Or if you have not had any formal training and you're interested in becoming a CNA or getting some CNA training, contact us, and we still have classes and training programs going on if you're looking for work and willing to assist during this time. We'll take a couple of questions now. Yes.
Okay. Dr. Shah, you mentioned that you guys are doing strict isolation. What does that look like for some of the people that have tested positive in your nursing home?
So they are, per the guidelines, anybody who's tested positive is placed in a private room. We've had actually, when we had, as the numbers are coming, we're getting more and more patients that are testing positive. So we're isolating them all in one area, away from all the other residents. And then of course the proper protective equipment that they have to wear. There are dedicated staff for those that are COVID positive versus those that are not. And you know, all the guidelines that we've sat down with the Health Department of Health, and we went through a tool, we've gone line by line, and that's what we're following.
Right. And do you,
How many residents are at Briarwood, and how many staff do y'all have?
I can't tell you exactly the number of staff, that's more of an HR question. But the residents, I think our census was around 88.
do you have a rough estimate of how many additional people you're looking to help out with staff moving forward after today?
We don't have numbers. This is more of kind of thinking ahead as all facilities in the state are doing everything that they can to prepare for this. And as you know, we mentioned before, as healthcare workers have become symptomatic or tested positive, those people aren't working in the facility. And so we have some people to back up, but we're trying to plan ahead as this develops.
Okay.
So in terms of the initial patient who tested positive, my understanding that person was at a hospital where they were tested and then came back to the nursing home, and then you got the positive test result. So did you know that resident had been tested at the hospital?
We have to sort of stay in compliance with HIPAA, so I'm really not at liberty to give that answer.
Okay.
What's the, go ahead.
Do you have a protocol for how you handle these situations when those positive test results come back? I'm asking because I've talked to someone who has a mother that's staying in that nursing home, and she says that they never knew that this was happening. They knew because of the news stations versus hearing contact from anyone in the nursing home when they got that first case.
No, I'm glad you asked that question. That's not true. We were quite proactive. You know, when I think Rachel and I were talking, the directive to lock down or came for the.
I think there are probably different communication points, and while we can't speak to every communication with every family member, what's been going on March the 9th was the first directive that came out from the Department of Health that was made available to the public in every facility, and that was following the CDC guidelines about testing temperatures and things of employees. On March the 12th, Briarwood activated some additional steps a day ahead of the March 13th second directive that came out. So we can't speak to every specific communication like that, but those are the steps they've been following.
We had already taken steps to limit any unnecessary traffic through Briarwood in anticipation of the COVID-19 that had already landed on our shores in other states, and we were already taking measures and steps. So I think we were quite proactive a few days even prior to knowing when our first
The other
patient
thing that I would add that we talked about a little bit before, anyone in Arkansas who has anyone who's out there that has a loved one in a long-term care facility, whether it's Briarwood or any other long-term care facility right now while all of this is going on, can you please, we appreciate your patience with the staff there, but please feel free to communicate with the staff at the facility to arrange a time to do a phone call, a FaceTime, send an email. We still want to encourage communication between those patients that are there and their family members at home, but we appreciate the patience. As everyone understands, it takes a little bit more time right now, and the facility's fielding lots of phone calls.
So I just want to make sure that there are 35 residents and 6 staff, which means that's 41 people that tested positive for COVID, correct?
Yes, we still have a few tests that are pending, the labs are working as the best they can in order to run tests and get them, but every resident in the facility was tested. So out of the few that are left, we don't know if this number is going to increase. We've had more negative results than we've had positive, which is also, reflects the good measures that have been taken at Briarwood.
So since you're actually working directly with patients, have you yourself, I guess, been tested at all?
Yes, I have. And I don't mind saying it because it's me. It's not a HIPAA violation. Because I'm telling you, I'm negative.
And when did you get yours? I know that throughout the state there's supposed to be, I guess, a limited amount of testing. So when did that testing take place?
Friday. I was tested Friday, and again, I have to give credit to the owners of the nursing home and the consultants that work with them, because as you know, the health department is overwhelmed with the amount of testing that they have to do. So in working with the health department, the owners and the consultants made sure that they contacted labs and personally brought kits and facilitated so that every resident at Briarwood could be tested. And I think, y'all, this is a big accomplishment to have done, and the staff that did it tested every single resident and tested the employees, and we've got all our tests out there. So we have done probably the most tests in one place, and this has been a joint effort, and I'm very proud of them for that.
We'll take 2 more questions.
So you got the first positive back on Wednesday? That was the first?
That we were notified.
Okay. And in terms of the segregation, what about the people who the test result has not come back yet? Are those people segregated from the negative?
Well, the people who have tested positive are in isolation. Essentially, all precautions are being taken for everybody. So
There's CDC guidance that talks about testing and talks about symptoms. There's a whole algorithm there, so we can't speak to the individuals, but that's what they're referring to.
Okay.
Do we still know how this virus spread to the facility at all?
how do we know this virus spread in the state? How do we know it spread in the country? How, so it's hard, it's out there. We don't know. This very, very tiny particle virus, the smallest, is, it's hard to track it down. And, who is exposed. That's why it's imperative that we all follow the directive that's come from the CDC, from our governor, social distancing, hand washing. So, it's hard to track it.
Thank you all.
Really quickly, the governor has been talking about the limited amount of PPE. Are you facing any issues with that? Are you looking to maybe use other people's equipment that they're making from these local businesses and things of that nature?
So in regards to PPE and long-term care, we've been working with our facilities, but along with the Department of Health and some resources from the Strategic National Stockpile to prioritize those to facilities that need it. As of right now, the facilities who have cases or suspected cases have adequate PPE, but as you all know, there's a national shortage, and we'll continue to work with the administration.
Okay, thank you.
Thank you all.
I just wanted to make a little comment before we left, or that for all those that are out there wondering about their families and elders at Briarwood, we are trying our best to keep life as normal as always. Even today, I was talking to Joan, our administrator, and these residents are coloring. We are doing our best in following all the guidelines and keeping them even in their isolation, that they are not just miserable, that we're keeping them engaged and trying to do our best that we overcome this in a very positive way.
Thank
Thank
you.
you.